好，歡迎大家。
Good morning, good afternoon. Thank you for coming to the press briefing. There are two parts to this press briefing. First of all, we will talk about the latest situation of COVID-19, and the second part will be on the investigation result of melioidosis. We have four speakers. Dr. Libby Lee, Undersecretary for Health, and then Principal Medical and Health Officer of the Communicable Disease Branch of the Center for Health Protection of the Department of Health, Dr. Albert Au, Dr. Simon Tang, Director of Cluster Services of the Hospital Authority, and Professor Yuen Kwok Yung, Chair Professor of the Department of Microbiology of the University of Hong Kong. First, there will be an update on COVID cases. Dr. Libby Lee. Well, thank you. Yes, this briefing today will be in two parts. The first part is on COVID, and the second part on melioidosis. Dr. Au will first start to give you an update on COVID-19 cases, and then Dr. Tang will talk about the situation at the hospital authority now, and then I will talk to you about test and vaccine pass. And then in the second part, Dr. Au and Professor Yuen will tell you about the investigation result of melioidosis. Dr. Au first.
Thank you. I'll tell you more about the latest development on COVID-19. As we can see in this graph, there has been a marked increasing trend in the past week. So in the past 7 days, compared with the previous 7 days, there is a 26.5% increase. Especially in these past few days, the increase has been significant. When we look at locally acquired cases, in the past week, on average, the daily number of cases has shown a 28.6% increase. If we look at imported cases, the increase is perhaps less significant. If we compare with the past 7 days with the previous 7 days, there has been a 5.7% increase. If we look at imported cases, they constituted about 7.6% of all positive cases in the past 7 days. If we see the table here, we can see that in the past few weeks, imported cases have we can see the percentage of inbound travelers tested positive here. And we can see that in the past 7 days, the percentage was around 3.92%. In these past few weeks, there has been an increase of inbound travelers, starting from mid-October, from some 50,000 travelers to last week, some 80,000 travelers. In these inbound travelers, the percentage that tested positive has shown a slight decrease. Currently, 55% of inbound travelers were identified as positive cases in the airport. For the rest, 44%, they have been identified in the subsequent 7 days. For deaths, the number remained stable. In the past 7 days, there were 68 fatal cases. When compared with the previous 7 days, the number was similar. For subvariants, the predominant strain is still B.8.5, accounting for 80.6%, followed by B.8.4, 4.1%. So we can see that there are new subvariants appearing in Hong Kong that include XBB. For now, we have recorded 47 locally acquired cases with XBB. The other is BQ.1.1, 55 recorded cases locally. And we can see that these new subvariant strains have shown a significant increase in Hong Kong. For residential care homes for the elderly in the past week, for homes for the elderly or home for persons with disabilities, we can see a significant increase. In this table, we can see that in the past week for RCHE, 55 institutions reported cases. From the previous week, the case number was at 44. As for RCHD, the previous week The number of institutions involved was 21. For the past week, the number rose to 30. As for schools, we can see that number of student cases has increased. In the past week, there were 3,871 student cases and 569 staff cases. The number of student cases has increased as compared with the previous week. For sewage surveillance, we can see that the data from EPD has shown that viral load per person has surpassed 600,000. This level is an increase when compared with the peak number recorded back in September. When we look at the global situation, according to the WHO, the latest data released by WHO shows that during the week of 7th to the 13th of November, the number of new cases increased by 2%, but the number of new weekly deaths decreased by 30%. But WHO remarked that because of a decline in testing globally, so the number of confirmed cases may not reflect the real situation. Global situation regarding subvariants, BA.5 remains predominant, accounting for 73.2%. BA.2, 6.3%, and BA.4, 3.5%. During the same period, there were some new variant strain which shown significant increase, including BQ.1, 16.2%. In Europe, the number stands at 18.1%, and in USA, the number is 44.2%. For XBB, the number has shown an increase, which now stands at 2%. In summary, in the past week, we can see that for locally acquired cases, there was an increase of 28.6%. Especially with cases in residential care homes. For imported cases, we can see that the number has shown a slight increase. For inbound travelers, the proportion of positive cases remains stable at about 4%. In neighboring countries or other places in the world, we can see that there are emerging subvariants, such as XBB or BQ.1. We see similar situations in Hong Kong as well. We have identified these new subvariants in local cases. Lastly, since the number of cases has increased in residential care homes, so we will be doing contact tracing for close contact regarding cases in residential care homes. So if persons who are classified as a close contact, they would be arranged to undergo quarantine in quarantine center. In the past, the period was 7 days, but to ease the pressure on quarantine center, these close contacts will undergo PCR tests on day 2 and day 4. If they obtain a negative result on day 4 and a negative RAT result on day 5, then we would allow them to leave the quarantine center and return to the RCH. Thank you. Next, Dr. Tang, please. In the past week, there has been an increase in the number of confirmed cases admitted to the hospital from 2,000 cases to more than 2,000 cases. And on average, for confirmed cases admitted to the hospital, the number is more than 2,300. Last week, newly admitted confirmed cases per day were less than 200, but the number is on the rise. In the past day, there were 290 patients who are positive with COVID admitted to the hospital. There are 90 critical or serious cases. After data submitted by hospitals, 60% of the patients were admitted due to COVID-related reasons. The other 30%, even though they were tested positive, but they were admitted to the hospital because of underlying conditions or other clinical conditions such as bone fractures. In the past week, the number of deaths who were COVID positive, among these patients, 60% of them die of COVID. For the rest, other conditions were the cause of death. For patients who are hospitalized, there is a rising proportion from residential care homes for the elderly. The hospital authority will closely monitor the development of the epidemic. Winter is approaching. Hospital beds, demands for hospital beds will increase because of underlying conditions. For example, shortness of breath or other heart-related problem, there may be a need for them to be admitted to the hospital. We have bed mobilization plan, and we will mobilize more manpower and beds to provide services needed. Other services may be adjusted. Many experts expect that we will be hit by both COVID and seasonal influenza. So here I appeal to the public. If you haven't received all doses of vaccination, please do so as quickly as possible, and you should be vaccinated for seasonal influenza as well.
有關入境嘅核酸檢測同埋有關疫苗嘅事嘅。我有個幻燈片，
可唔可以工作人員幫我哋睇一睇個幻燈片？唔該。
So I'll be talking to you about arrangement for PCR tests for arrivals and also the vaccination issue. Now, starting from the 21st of November, we will adjust the PCR test requirement for arrivals from overseas and Taiwan. Now, on the day, they have to still undergo the test and go arrangement, that is PCR test, and then second day, they also have to take a PCR test. We will remove the PCR test requirement for days 4 and 6. And for arrivals, they must still carry out daily rapid antigen test until day 7. Now, we have been reviewing the relaxation of the immigration arrangements since the 26th of September, so we've been monitoring the situation. You can see for the blue line, those are the figures before relaxation, and the red lines you show the figures, the daily, the weekly average figures since the relaxation of the measures. Now we have days 2. We do PCR tests on days 2, 4, and 6, and you can see that there is a slight increase in percentage since the relaxation from 3.1% to 4.5%. But then in terms of the proportion of increased cases, they're stabilizing. Now from the 26th of September to the 6th of November, in those 6 weeks, the percentage is 4.5% compared to the previous period 3.1%. It's still within the acceptable range. And if you study the figures carefully, you'll see that among the confirmed cases, now arrivals undergo the test and go arrangement. That means they do PCR on day 0, and on day 2 they do the PCR test, and then we are able to identify 82.8 of the infected cases. So the under the red line here, And then for days 4 and 6, we find another 0.4% or 0.1% of cases. That means for every 1,000 travelers or arrivals in Hong Kong, we would detect 4 or 1 cases. There is a short incubation period for the Omicron subvariant. Just now, you mentioned that you heard from Dr. Au that for the quarantine centers, we would shorten the PCR test period to 5 days. And then, of course, now we have 0+3 arrangement. People are able to go around after 3 days on arrival. And then, if they test positive on days 4 and 6, then we have to see whether they still present a risk. And so we have therefore balanced the need for medical surveillance and the impact on arrivals, and we will adjust the PCR test requirement. The relaxed measure will take effect from the 21st of November. In other words, for arrivals in Hong Kong today from overseas and Taiwan, then on day 4, that means on the 24th of November, they do not need to undergo the PCR test. Also, they don't need to do the PCR test on day 6. So, in other words, for those who are already here, they still have to do the PCR test on days 4 and 6. But starting from today, people who arrive need not to undergo the PCR test on days 4 and 6. So, I must stress that we have not changed the medical surveillance arrangement. The enhanced measure is just to remove the PCR test requirement for days 4 and 6. So for arrivals from overseas and Taiwan, they must still continue to do daily rapid antigen tests for 7 days. So that's why even for the small number of positive cases identified after day 3 will still be found. And then for those coming from the mainland and Macau, they will still have to do PCR tests at day 2, and that remains unchanged. Now, I'd like to talk about 2 issues in relation to the vaccine pass. The first is the transitional vaccine pass arrangement. The government announced that starting from the 30th of November, for those aged between 5 and 11, they must have completed 2 doses of vaccine, and for those aged 12 or above, they must have completed 3 doses of vaccine before they could meet the vaccination requirement under the vaccine pass. We find that we notice that in some cases, there are real medical reasons that people cannot get vaccinated, so they are issued with a medical exemption certificate. But then maybe after medical assessment, it's found that certain individuals could now take the vaccine, and so if they start taking the vaccine, they may have to wait at most 6 months to complete the 3 doses of vaccine. That means they cannot meet the vaccination requirement under the vaccine pass. So in the light of that, the government is going to introduce a transitional arrangement. So for those who hold now or previously held medical exemption certificates and who have started taking vaccine, but they do not yet meet the vaccination requirement of the vaccine pass, they will be issued with a transitional vaccine pass. So we will therefore amend CAP 599L, Prevention and Control of Disease Vaccine Pass Regulation. I must stress that this arrangement is to encourage those who currently hold or previously held medical exemption certificate but who are now fit to take the vaccination to receive the vaccination as soon as possible. So that's the purpose of this arrangement, is to encourage them to get vaccinated as soon as possible. Now, there are 2 major groups of eligible persons under this new arrangement. The validity period of the transitional vaccine pass will be up to the recommended date of the next dose of vaccine. As I said, there are 2 groups here. The first group are holders of medical exemption certificate who plan to start getting vaccinated. So starting from the 30th of November, starting from the 22nd of November, these people could take with them their medical certificate with the QR printed and go to the community vaccination center community vaccination station, a vaccination center of the at public hospitals, and also at clinics of certain clinics of Hospital Authority and Department of Health, and then they could get vaccinated, and they'll be issued with a transitional vaccine pass, which is valid until the recommended date of the next dose of vaccine. And then the other group are those who hold medical exemption certificate who have started getting vaccinated. So say by the 22nd of November they have taken the first or the second dose of vaccine, but there's not yet time for them to take the next dose of vaccine, so they could again bring with them their medical certificate printed with a QR code to apply for and vaccination record to apply for a transitional vaccine pass. The validity date of the transitional vaccine pass would be from the date of the last dose of vaccine to the date of the to the recommended date of the next dose of vaccine. So for those who have this transitional vaccine pass, now if they get vaccinated at private clinics or private vaccination station and so on, they could go to any vaccination stations to apply for the transitional vaccine pass. And if they get vaccinated under the Hospital Authority or the Department of Health clinics, then they could just go back to the same clinic to obtain the transitional vaccine pass. So this is a sample of the transitional vaccine pass. Now, it depends. If the person has already taken previous doses, then the validity will start counting from the date of the last dose of a vaccine. Now, or it would start counting from the date of vaccination, the first vaccination. Now, individuals will have to update to version 3.5.2 of the Reform Safe app, and then they will get a blue code if they are issued with a transitional vaccine pass. And this will allow them entry into scheduled premises. There's also need to update to version of 4.5.5 for this other app, and then where there's active checking of that is for the scheduled premises, they have to update to this new version because they need to do active checking of vaccine pass. Now, actually, very few people are not fit for vaccination. The majority of people are fit for the two type of vaccines available in Hong Kong. For those, for people who have not been adequately vaccinated, and if they go into high-risk places, they would be at more risk. So I would appeal to everyone to get vaccinated if your medical condition allows. You don't have to wait till the vaccination period the validity has lapsed. And the second question is the BioNTech bivalent vaccine. Now, the joint scientific committee and the expert advisors panel of the CE, they have studied the scientific evidence involving the BioNTech bivalent vaccine, and then for BA.4 that is BioNTech vaccine for BA.4, the Omicron variant, it could be used as a second dose. And then Foshan has, in accordance with CAP 599K, apply to use apply for emergency use of this BioNTech bivalent vaccine. And then we have considered the views of the expert committee on vaccine, and then the Director of Health has exercised her powers to allow emergency use of this new BioNTech vaccine. And after discussion with the pharmaceutical company, we have already procured the vaccine. It will arrive in Hong Kong soonest at the end of February. Now, we have procured this new vaccine because we want to offer an additional choice to those who plan to take the fourth dose of vaccine. We are starting preparation, and then we hope that we are able to start administering this vaccine within December, because it will arrive soon, this vaccine. I must appeal to members of the public to get vaccinated as soon as possible. You just heard from Dr. Au. We are seeing more confirmed cases in residential homes for the elderly, so we want people to get vaccinated soon. Now, for those who've had 3 doses of vaccine and who are aged 18 or above, they could get the 4th dose. But if you're above 50, we encourage you to take the vaccines even sooner. And for others aged between 18 and 49, if you have your own needs or if you will visit high-risk places, you could also consider getting the 4th dose of vaccine. And if you plan to travel and so on, we would suggest that you take the 4th dose as soon as possible, so allow time for your antibody to build up. So that's all for vaccine for COVID-19. Now I will hand over to Dr. Au and Professor Yun to talk to you about the investigation result of myeloid doses. Thank you. I and Professor Yun will be talking about the latest about myelodoses. As at the 16th of November, we have recorded 36 myelodoses cases involving 26 males and 10 males aged between 42 and 93. As we previously announced, 27 cases were recorded from August onwards. And between August and October, there's a notable increase in the number of cases. Most of the cases involve people living in Shamshui-Po. There are in total 20 cases. The onset date was between the 8th of August and the 17th of October. Because we have seen relatively more cases in Shamshui-Po, so together with the Hong Kong University, we have conducted a large-scale environmental investigation. From between the 10th of October and the 1st of November, we collected 431 environmental samples, including drinking water, biological membrane swabs in water pipes, items used by patients, and soil samples in the area and so on. And also the area covers places where the confirmed cases live or nearby parks and construction sites, Shek Kip Mei Service Reservoir, Butterfly Valley Service Reservoir, and Mount Beacon Service Reservoir. And then there are 38 samples tested positive for the Burkholderia pseudomyeliae bacteria, including 2 samples from the water pipes and a vase of infected patients' homes, and then also other soil samples and so on. And then the Hong Kong U team also successfully cultured the bacteria in soil samples collected from Shek Kip Mei Service Reservoir. And genome sequencing shows that the genetic sequence is highly similar to those found in infected patients. Now, as we cultured we were able to culture the bacterium from soil samples. We conducted other studies. Between the 3rd and 9th of November, we collected over 200 environmental samples in the water samples of surface reservoir at the top end of the air vent of the reservoir, and also exposed part. We took swab samples, and also in the soil surrounding the air vent, we also took samples and so on. And there's 87 samples from Shek Kip Mei and Butterfly Valley Service Reservoir. Samples were collected, and 5 samples from Shek Kip Mei Service Reservoir collected from the air vents. They all tested positive. And then there are other samples or swab samples collected from the air vent, and 5 on the air vent and 1 nearby. They cultured negative. And then for all the water samples collected from service reservoir and also swab samples, the PCR test result was negative. It shows that the water body of the service reservoir has not been contaminated. So far in our investigation, for all the water samples collected, including those from the service reservoirs and the water meters of infected persons and so on, the test result was negative. It shows that there's no contamination of drinking water and in pipes. And then considering the and also we don't see any anomalies in all the water samples collected. So based on the epidemiological environmental investigation outcome, there is no evidence to show that the infected cases are related to the supply of water coming from the service reservoir. So we cannot confirm the transmission route. Now, this virus actually, this bacteria actually is always present in Hong Kong, and in the past few weeks we've seen a drop in cases. We have already made this melioidosis a statutory notifiable disease. We will continue to monitor all such possible cases. Now, in Sham Shui Po, there were relatively more cases, so we would suggest that for residents in Sham Shui Po, especially the elderly and the chronically ill, they should allow the tap water to run for at least 1 minute first thing in the morning before they use such water for washing their face, bath, showering and whatever. Also, they shouldn't drink unboiled water. We must stress that the Water Services Department has always followed stringent protocol in treating potable water, and then there is a regular water quality monitoring of potable water is to ensure that water supply is entirely in line with our standards. Now, the Water Services Department uses chlorine to disinfect water, drinking water, so to avoid the breeding of bacteria in the course of transmission, the Water Services Department has followed the WHO's recommendation to allow residual chlorine in drinking water, this so that pathogens could not survive. Now, because although our drinking water is in line with the reference standard, we want to give more assurance to the public, so we have taken a series of measures additionally. Firstly, we have increased the residual chlorine level in drinking water to give additional protection to the public. Secondly, at air vents of the Sham Shui Po Service Reservoir, we have installed high efficiency filters, and also for another 124,000 air vents of other 175 service reservoirs. We'll also be adding these filters. It could be completed within 2 months. And then at the Sham Shui Po Service Reservoir water outlet, we have installed the real-time residual chlorine monitor. This will make sure that we adopt a risk-based strategy in ensuring water quality. Thank you. I now hand over to Professor Yun. I would like to thank the Center for Health Protection and the Water Services Department for allowing the Hong Kong University to take part in the investigation into the outbreak of Burkholderia pseudomyliae. As you can see, in 2021, there's already a trend that there's an increase in infection cases involving Burkholderia pseudomyliae. In 2020, we've seen a sharp increase. But then, in any case, between July and October, there was a peak. If we look more closely at this data, you see that between 2016 and 2027, on average, there were just 7.6 cases per year. In 2022, there were 36 cases. 2021, 70 cases, and that's of course a substantial difference with 7 cases. So that means there's a outbreak for sure. And if you subtract it, say from 17, already between 2021 and 22, there's a difference of 19 cases, which is double the average number between 2016 and 2020. And more importantly, these cases are found in Sham Shui Po. The red dots are the infected cases. They are all near the service reservoir and a construction site there. So that's why initially we had suspicion if it was the construction site that was the cause of the problem, was it the service reservoir. And then in Sham Shui Po, you could see that water supply comes primarily from the Shek Kip Mei service reservoir. Only a few sites receive water supply from the Mount Beacon service reservoir. This is the construction site. Initially, we thought it must be the soil, the contaminated soil in the construction site that caused the infection. But then we collected soil samples, and we found that although there's a very weak positive of a DNA, we couldn't culture the bacteria. Now, around among the 100 plus workers, over 30 had underlying condition, but there's no outbreak. And then also we know that there's no use of the underground water at the site. So that's why we propose to use slaked lime to cover the soil to reduce the risk of exposure to this bacteria by workers. So if it's nothing to do with the construction site, then we visited the patients' homes, and we wanted to see if it's the items they use or it's because the environment that caused the contamination. And then we found that at a bathroom, wash basin, tap, or the vase, the water in vases, some samples tested positive. So that's why we wanted to check whether it's something to do with the water. So you see this is my colleague taking a swab sample from the basin, tap, and then also from the vase. And this sample is tested positive. Now there is an obvious outbreak in Shamshui-Po. And for the sink tap sample and the flower vase sample, there's a RT-PCR positive result. So we have to check whether it's got something to do with water supply. This is satellite image showing Shamshui-Po. This is the Shak Kip Mei Service Reservoir 1, and here Service Reservoirs 2 and 3 further down. So you can see that. It's a location map. And then, so we went to the Shak Kip Mei Service Reservoir. We only took a few soil samples. Already one soil sample tested PCR positive. And then for Service Reservoirs 2 and 3, we also collected samples, and we found 4 samples tested positive. So for this reason, we therefore took samples from other service reservoirs. For the Butterfly Valley service reservoir, there's 1 positive sample. And then we went into the Butterfly Valley service reservoir to check the environment, and also to collect environmental samples to see if something went wrong with the service reservoir. Well, because initially we just took a few soil samples, and a sample actually tested positive. So we asked the Water Service Department to help out, and their colleagues were very cooperative. They helped much. They dug up the ground down to 30 to 60 cm, so we could collect soil samples from a deeper level. So you see, we did a really detailed job. So we measured for every 10 cm, we collected samples all the way down to 40 cm deep. So we conducted a very stringent environmental test. So this is Shak Kip Mei Water Reservoir 1, number 1. We collected 20 samples, 3 were PCR positive. This is Reservoir 2. Also collected many samples, and many tested positive. So that's the surrounding of the reservoir. And the Water Services Department, was really careful, and then eventually they drained off reservoir number 2, and so that we could go in and check whether there could be any cracks on the top of the reservoir, or maybe there could be a salt seepage of some sort. And then they checked, and there was no problem whatsoever. You can see at all these joints, we couldn't see any seepage at all. We don't see any cracks either. And then this is one of the air vent. When water is drained away, there's this negative pressure inside, so there's need for air vents for air to come in, so that there could be equalization of the pressure inside and out. And then they use polysulfide here to prevent seepage. And then so far, as at the 16th of November, we have collected 548 environmental samples to test them for the Burkholderia pseudomyliae bacterium. And then we found that it's in Shekip May service reservoir numbers 2 and 3, we see the highest number of positive samples. In some cases 85%, and then cultured positive 45%. That's what we could find. And then at the AFNs, we also collected swab samples, and you see here 40%, close to 40% for both reservoirs number 2 and 3 of PCR positive samples. And then at the 4 corners of the air vents, we collected soil samples, and then we found many of these samples tested positive. We were able to culture 5 positive samples out of 20. So out of 584 samples, PCR positive 139, culture positive 22. But you have to, appreciate this. It's very difficult to culture this Burkholderia pseudomyliae sample bacteria from soil samples because the soil contains so many other different types of bacteria. So the bacterial level has to be high before it could be cultured. This is another air vent. It's covered here, this black cover, and if you take away the black cover, you see here there's a metal there's a metal mesh here so that insects could not go into the reservoir. So after this investigation, I find that there's a really high quality of water supply arrangement for Hong Kong. But then we have to admit to one thing. That is, when there's a strong wind, it's possible soil could be brought into the service reservoir through the air vents, because this is only about a meter up from the ground level. So if the air pressure inside is low and then there's strong wind outside, it's possible that air from the outside could go into the reservoir. Here you can see we collect swab samples here, and you see a lizard. And then you can see that the mesh really works. These insects cannot go into the reservoir because insects could bring soil into the reservoir, but then they couldn't get into the reservoir. So here you can see we could use a DNA test to test the Burkholderia pseudomyliae bacteria, and we found that on the mesh. So we're able to culture the bacteria from these samples. This is another swab sample collected from inside the reservoir. It's on the roof and the joint between the roof and the wall, and that's one positive sample. And then the Center for Health Protection helped us do genetic sequencing, and we find that the genome sequence of the bacteria found in patients and found in these samples are very, very similar. So you can see that they are very similar. So there is reason to believe that these bacteria in the soil did go into the blood of patients. But the question is, how did the bacteria find a way into the blood of the patients? That's something we still could not establish as at today. So whether it be PCR test or bacterial culture, for the 46 samples given to us by the Water Services Department, they all tested negative. So in other words, we are not able to find bacteria in water at all. And then for the residual chlorine test, you see that the level is normal. There is sufficient quarantine concentration to make sure the water we drink in Hong Kong is safe. So we've done a lot. And there's enough chlorine in water, and then we're not able to culture the bacteria from samples collected from reservoir, and also PCR test results are negative, so we couldn't find the bacteria in the water. So at this stage we have to admit that we had not been sure about the source or the transmission route of the bacteria from the soil to the blood of the patients. We still cannot be certain at this point. But there could be high-risk factors that we managed to identify, and that could have led to the outbreak first. With rising global temperature, there is also rising temperature in Seoul, so definitely the Burkholderia pseudomyia count in Seoul would increase. And then we see that there is a risk of bacteria-laden dust going through the air vents, because there are some 10 to 20 such air vents per reservoir. And then when water is drained away, and then there's decrease in the water pressure inside the reservoir, so the dust may then go into the reservoir through the air vents. Third possible risk is that there is decreasing free residual chlorine level in drinking water with rising ambient temperature. It is especially the case in summer. And finally, we have a rapidly aging population, especially in Samchepo. There is a high concentration of elderly residents, and most of them would have a chronic illness, so there's definitely a high risk of such infection. And so that's why we make some recommendations to the Center for Health Protection and the Water Services Department, because we're not able to detect any bacteria in the water body. But then in the soil of the service reservoir and the air vents, we saw signs there's a chance of the bacteria going into the reservoir. So to reduce risk, WSD has already increased the residual chlorine level to 1.2 ppm in water, starting from the 24th of October. And this arrangement would extend to all reservoirs in Hong Kong. And the second measure is to add the high efficiency particulate air filter to the air vents to reduce the risk of bacterial contamination of reservoir waters. And finally, they're also considering whether it's possible to install UV sterilization device at the outlet of service reservoir. And they have also started continuous real-time monitoring of chlorine level to see the level remains sufficient. And then for all these risk reduction measures, they will be extended to all freshwater service reservoirs in Hong Kong. This is a means to reduce the risk. And then we would advise the residents to let tap water run for a minute first thing in the morning, and they shouldn't use and then before they use the water for rinsing the mouth, brushing their teeth and showering, and so definitely they must not drink it, especially if you are old or chronically ill. You must not drink unboiled water. And for construction site workers or residents in Samchepo, if you have a fever, you have respiratory symptoms or pus collection, you must tell your doctor that you work or live in that area, so that patients could carry out suitable tests for you, say on your blood or on your respiratory specimens, urine, or even pus. So such specimens could then be sent for culture. Now, if you do not tell the doctors or laboratory that you want to do culture for this particular bacterium, maybe the laboratory won't be able to find this bacteria, because in sputum it's possible that there are other bacteria. So if you don't tell them specifically, they don't know you're looking for the B pseudomyia, and then there could be a false negative result. So we of course we could also check your serum for the antibody. Now, what about the situation elsewhere? In Singapore, you know, they have 30 to 60 cases a year, and then with global warming, we believe in Hong Kong we will be seeing more and more such cases, melioidosis cases. As long as there's no clustering, that's fine, because then that means there could be a specific source of infection. So we may be seeing more and more cases, but I hope you understand that as long as there are no clusters, then we need not be too concerned. Now, this disease is now made a statutory notifiable disease. So when we do more tests on patients, then we'll probably be detecting more melioidosis cases. I think that's all I'd like to say for now.
咁跟住落嚟咧就
Thank you. So it is now time for Q&A. Before you ask your question, please state the organization that you're from, since we cover more topics today. So please keep your questions concise and limit yourself to 2 questions. On the right, the last row, the 4th. Hi, I'm from Now TV. Last night, there has been some late night change to the measures. Why would these changes be made in the middle of the night? Do you have anything to respond regarding this? Since the number of positive cases among inbound travelers had remained stable, would there be a chance for 0+0? Would there be a requirement for the public to receive the bivalent vaccination as the 4th shot? Well, I will answer these 3 questions. The first one, regarding some relaxation of the anti-epidemic measures, including for ice skating rink and cinemas, no active checking is required. However, for places with high risk, for example, you have to take off your mask to eat or to do exercise, these places carry high risk. Last time I've mentioned that in some cinemas you are allowed to eat. It is the same for ice skating rink. Some you have to wear a mask in, some you don't. After our announcement last time, we have heard comments from the public or from the media that this has caused some confusion since they are not sure in which cinema they are allowed to eat or not. So to ensure smooth operation and for the public to be able to easily understand which places active tracking is required, so we have include cinemas and ice skating rink as premises that require active checking. As for checks or testing for inbound travelers, now travelers will only need to perform PCR tests on the 1st and 2nd days. So is there any room for relaxation? Well, like the CE said, it is not important 0+ what number. Well, you can see that there is a rising trend for the pandemic situation. So we have to strike a balance between anti-epidemic measures and our citizens' livelihood. And we want to resume to normalcy as quickly as possible. As for the bivalent vaccines, do you mean that will it be a requirement as the 4th shot of vaccination? We are following the advice from experts. Currently, we haven't revised the number of boosters required, but for persons aged 50 or above, many of them have chronic illnesses. So it is highly recommended that you get the 4th booster shot. As for people aged 18 to 49, if you are about to conduct high-risk activities or you're about to travel, then we recommend that you take this booster dose as well. You need time for your body to create antibody against the COVID virus. Lady on the left, please. Hi, I'm from cable TV. I understand that this is to avoid confusion from the public, but why were the measures announced so late at night last night? Today we asked members of the public whether or not they understand which places belong to active checking and which passive checking. So will there be a clearer classification so that the public will be able to understand more easily? And just then you mentioned that the number of cases has shown an increasing trend, and why is there a relaxation in the measures for inbound travelers? For new rounds of relaxation, the changes will come into effect today, so we need to announce them to the public clearly before they come into effect. Members of the public may be confused about where active checking or passive checking is required. So cinemas and ice skating rink will be part of the premises that require active checking. if you enter indoor premises, then they require active checking. With your mask off, then there is active checking. Well, I would like to reiterate that we haven't relaxed measures regarding inbound travelers. We have simply improved it. Inbound travelers will have to conduct RAT tests until day 7. Since PCR test is more sensitive, so we are keeping them for day 0 and day 2. Lady in black on the back.
Suddenly change the passive testing venues. And do you have anything to respond to the disappointment, frustration, and confusion from the citizens because of the sudden change? And will the government further require citizens to have 4 doses of vaccination before entering the listed premises? So since you said the imported case number stabilized, will the government consider to further scrap all entry restrictions and implement 0+0? Thank you.
I can't hear the last question clearly. Can you repeat?
Because you said the imported case number kind of stabilized. So will the government consider to implement 0+0? Thank you.
Okay. So concerning the active and passive scanning of the vaccine pass in different premises, since last week we have announced the principle of actually having active checking for the vaccine passport in various premises. The key is whenever individual goes into a premises, they need to take off their mask, either for exercise or for food and drinks. We will consider it is actually a high-risk behavior. And so we recommend, we would like to keep the mask, we would like to actually actively check their vaccine pass before they enter into this premises. For those 4 doses, we will make the 12 doses as mandatory, right? So as we advised by the expert group on vaccination, at the current moment, government do not have a plan to make it a mandatory requirement for the 4th dose of vaccination. Yet, we will highly recommend those 18 years above to have the 4th vaccination, especially the group more than 50 years old, likely because the group may have more chronic disease and they actually, the health conditions might be more severely affected by the infection. We highly recommend this group to have the 4th dose. But for those 18 to 49 years old, if you will go for somewhere with high risk of infection, for example, are you planning to travel abroad, we highly recommend you to have the 4th dose as well. The key is actually to have it earlier because, you need some time for the body to adapt and to produce the antibodies. So we highly recommend if you are going to have the 4th dose, do it earlier. The last one, the rate of inbound traveler, the infection rate seems to be stabilized at around 4%. So will we consider further release, the restriction? This is a trick question, as we previously mentioned. The way that we relax all this social distancing or inbound travelers restriction, the key is we have to look at the situation within Hong Kong, especially our public healthcare system, whether it is leaning onto the edge of collapse or not. I hope that through this section today, you hear from Dr. Au and also Dr. Tang. The total infection rate in Hong Kong is actually rising, and the hospital starts to feel the pressures. The beds are quite tight at the moment, and so I guess we all agree that we do not want our healthcare system to collapse. So we will actually gauge, the pace of further relaxing carefully with the infection rate of Hong Kong.
好，下一個提問，右手邊最後排嗰位男士啊。
To the right, on the last row, the gentleman over there. Yes, I'm AM730. First about COVID. Now, you say that there will be earlier termination of quarantine for residents of RCHEs. And what about close contacts in Hong Kong? We know on day 3, is there a high percentage of positive cases? Could they also follow the same quarantine arrangement for earlier termination of the arrangement? And then for those who, for the transitional vaccine pass, for those who've had the 1st and 2nd doses, they could then get this transitional vaccine pass. In the past, you said that from the 30th of November, definitely everyone will have to get 3 doses. But how come you are now relaxing the arrangement and allowing this transitional vaccine pass? And then on the melio doses, you have investigated cases. Now, is there evidence that the infected persons came into contact with soil? Would there be any similar high-risk factors? I will first answer the two questions on COVID, and then I will ask Professor Yun to talk to you about soil samples. Now, for local quarantine cases, I don't have the figures here. I don't know if the CHP has the information for you. As for the transitional vaccine pass, why are we introducing that now? Well, the reason is because we know that some people actually want to get vaccinated, but because of their health condition, they're not able to complete the vaccination before the 30th of November. For example, someone needs to do an operation, and then doctors may ask them to wait a bit before and after the surgery. So this will be transitional factors. And then for these residents, if they can only enter scheduled premises if they're fully vaccinated, then they're starting from the 30th of November, then that means they will have to wait a long time. So we've heard their views. And so as we amend CAP 599, we are, the powers are now with the Secretary for Health. And then for these cases, he could allow a short transitional period. And you say this a short transition period is until the date of the next dose of vaccine, because the aim is to encourage people to get vaccinated as soon as possible. Melioidosis, Dr. Au or Professor Yun? Now, if I may respond to your earlier question about close contact, an earlier question first on quarantine arrangement of close contacts. Now, for home household close contacts, they have to be home quarantined for 7 days. And then among these people, we find that there are about 20% of the close contacts would actually become infected. And because they are in home quarantine, so they cannot take the PCR test, they could only do the RAT. So the usual requirement is that if they've had 2 doses of vaccine, then on days 6 and 7, if the RAT result is negative, then we can be sure that the person has not been infected, so that will end the quarantine. But then for close contacts of RCHDs and RCHDs, the situation is a bit different. They will be sent to quarantine facilities operated by the Social Welfare Service Department, that is at AWE. And then we will also do medical surveillance, and PCR tests could be arranged for them. And you know, of course, for PCR tests is more sensitive. And we believe there's a short incubation period for Omicron. So by day 4, if the PCR test result is negative, and then on day 5, the RAT result is negative, then we could be sure that the close contacts have not been infected, and so they could safely go back to their home, the residential care homes. So this will help to shorten the quarantine period, and then we'll be able to free up more quarantine places. In case there's a surge in the number of cases, then we will make sure we still have enough quarantine facilities for residents of the residential care homes. Your second question on melioidosis. Now, after we have detected that cluster, we have conducted epidemiological investigation of each and every case. We've asked them where they've been, persons they've contacted, or what they ate, which restaurants they went to, and so on. And then in our investigation, we could not establish any links among the cases. For example, going to the same restaurant, or many infected persons visiting the same restaurant. We have not found that. And we also found for many of the patients, they had underlying conditions. They don't actually go out much. Usually they stay home. And if they did go out, probably they would just go to the park or so on. And as Professor Yun said, initially we were not sure of the transmission route. We had no evidence to go by. And so one possibility was a contaminated soil that's blown elsewhere by wind. And that's the initial direction in our investigation. And then eventually we found at one of the water tap of infected person, the swab tested positive. So we thought maybe it came from water. And so we went to Service Reservoir to collect soil samples for testing. And then the soil samples did test positive. And also the genome sequencing shows that the genetic sequence is similar to that. in the soil sample is similar to that of the patient's sample. But then still we couldn't find any bacteria in the surface reservoir water body. So we cannot confirm, therefore, is there's contamination of the water body that's led to the infection. So far we still do not know the cause of the infection. For most of the cases, when we ask the patients, there's just a small handful of the cases that involved that involve planting, but most people didn't come into contact with soil. Next, please. To the right, second last row, the one with long hair. I'm from Ta Kung Pao. About the BioNTech bivalent vaccine, would it first be administered to the elderly or those with low immune efficiency? And now initially, it's expected that the bivalent vaccine will be available in December. So is that the case? Now, for the bivalent vaccine, the expert committee's recommendation is that for the original BioNTech and the BioNTech bivalent vaccines, they are both as effective. So we would not say, therefore, there should be a priority to a particular group. Now, because for now, the fourth dose is voluntary, but we would strongly recommend for those aged 50 or above, it's best that you take the fourth dose. And for those aged between 18 and 49, if you engage in high-risk activities, you must also get the fourth dose as soon as possible. But for now, the fourth dose is not compulsory. As to when the bivalent vaccine will be available, we will make an announcement later. We hope that we could allow the fourth dose of bivalent for members of the public soon. Next, to the left, the gentleman there in black. I'm from Hong Kong 01. There's mention of the transitional vaccine pass. So with this new measure, would people be able to follow the arrangement? As for the fourth dose, just now the Undersecretary appealed to the public to take the fourth dose. Before we were told that 3 doses are enough for protection, but now you're making changes. I remember last week you said that there would be criteria to follow for the government to relax the vaccine pass arrangement. So it's in the case the government is undecided about the vaccine pass criteria. That's why all of a sudden last night you announced changes to certain measures. And then on the melioidosis, Professor Yun, you said before there was suspicion about contamination coming from the, coming into the water, to the reservoir through the air vents. Now you've tested the water body many times and there are no problems. What about other spaces in the surface reservoir, or maybe it could be sand going into the water and eventually that's carried to the infected person's home? Is that possible? Well, that's a very interesting investigation. It's a challenge for myself because I've been playing this game for so many years. Still, this one is challenging. Now, if you've been to a surface reservoir, you know this is an entirely enclosed space. Above it, there's the grass pitch and that with soil. So there are only a few ways to gain entry into the water body. Either you open a door to the surface reservoir and that door is always locked. And then above the surface reservoir, there are about 10 to 20 air vents. They are all covered. So air could only go through the cracks. And the third possibility is on top of the reservoir, there's the joint between the walls and the rooftop, the roof, and there could be cracks, but then we couldn't find any. Well, yes, true, there's one swab sample that tested PCR positive, but then we have not found any other problems with the other swab samples, and we haven't spotted any seepage. So there's only one possibility remaining, that is something has gone in through the air fence, because if the water level drops, there will be negative pressure in the reservoir, so air may go inside, and if there's a strong wind or rain outside, and then maybe small sand particles are blown up, and then they might squeeze through the metal mesh through the air vent and get into the water body. Well, that's so far the only possible explanation we could come up with. But then we have to be able to find the bacteria in the water, but all test results are negative. So there's no way we can be certain about how the bacteria in the soil, the service reservoir, find a way to the infected patient. Still, we couldn't find the transmission route. Is it possible that there is soil blown from the service reservoir to the homes of the infected persons? Now, the reservoir is located to the northern side, and residents are on the southern side. In summer, is usually southwesterly wind, so the wind direction is opposite. So that's why, at this point, we still cannot be sure why the DNA sequencing of the bacteria found in the soil is so similar to that in the bacteria found in the patients. But still, we couldn't find the transmission route, but then there's circumstantial evidence that there could be a link between the infected persons and the topsoil of the reservoir. And so that's why we have made a number of recommendations to the WSD to lower the risk as far as possible, and that's all we can do at this point. Now, we are talking about thousands of gallons of water being used every day. And every time we test water samples, we just collect a small sample. It's not possible for us to test several tons of water, of course. So, of course, then there is sampling error in terms of the random error in collecting samples. So it has to be that the bacteria go through into the water body, and then the water we collect actually contains the bacteria, but it's not always possible. So we cannot entirely rule out the possibility of water contamination leading to the outbreak. So that's why we are proposing so many measures to try to minimize the risk. So I would like to thank colleagues of the Water Service Department. They have done a lot to help us collect so many samples, and then they are taking many precautionary measures to try to reduce the risk. Thank you.
咁咧，抗疫咧，從
Anti-epidemic measures are efforts that need to be done by all of the public. After the previous announcement, we have received some queries from members of the public. They were not sure in what premises active tracking and passive tracking is required. So we try to simplify them into this. If you enter an indoor premises and you have to take off your mask, then we see it as high-risk activity, which requires active tracking. This is the principle. So after listening to comments from the public, we understand that we are all at different stages. Some of them were unvaccinated, but some of them have already got their fourth shot. So for clarity's sake, we have amended so that for cinemas and public ice skating rink, active tracking will be required. So will the fourth dose be mandatory? For now, we haven't received advice from experts regarding this. So we have to see the development, the trends, to see if it is needed. At the current stage, the fourth dose is not mandatory. Next question, please. To the right, the one in blue. I'm from Oriental Daily. I would like to ask Dr. Lee. Just then you said that you will respect opinion from members of the public. Well, many of them would welcome 0+0, a cancellation of medical surveillance. The percentage of positive inbound travelers is now 4%. So at what percent will you consider relaxing the measures further? On a weekly basis, the increase was 5.7%. So you can see that the situation is not serious for inbound travelers. So under what condition will the medical surveillance be shortened? Perhaps for the Amber Code, we will shorten it from 3 days to 2 or 1 day. Also, in terms of death cases, past week there were 68 death cases. According to the hospital authorities, 60% of them die of COVID. So that means 40 cases. For 6,000 new cases. So for a week, there is 40,000 with 40 deaths. So the percentage is rather low. So do we still need these kind of strict measures, especially for inbound travelers or local anti-epidemic measures? Is there any room for relaxation? Thank you. I understand that different members of the public will have different demands. Just then I said that our society is comprised of people from different age groups. Of course, we want everyone to be healthy, and we want to make sure that they are healthy. In the current rising trend, is there room for relaxation of anti-epidemic measures, including measures for inbound travelers? If we look at the situation, the trend is going up, so we need to keep an eye on the upcoming trend. We have to be careful at this stage. So it is difficult for me to say at what number or what percentage will we relax the measures. We have to look at the whole picture. I would like to reiterate that for the young and old, they are the targeted group of protection. They are the weakest links. In this press briefing, you can see that for the newly admitted cases, the majority were elderly. And we are particularly concerned about elderlies from residential care homes. So we want people from these two groups to do more to protect themselves, including getting vaccinated. I hope that friends from the media will help us promote this as well. To getting vaccinated will reduce the chance of serious conditions, and it will help with the stress we have on the public healthcare system, and will help in our road to resume to normalcy. Also, other than looking at local cases, we have to keep an eye on the global development. Lately in Canada, the cases have been serious for children. Perhaps you have heard about it. Currently, there are 3 outbreaks, including COVID, RSV, and seasonal flu. Some foreign media has described it as a 3-headed beast. We are very concerned that this may happen in Hong Kong. Drugs are in short supply. So we have to keep an eye on imported cases. We don't want them to impede our recovery to normalcy. So if you are not vaccinated, then you need to get vaccinated. It's not just about the young and old. It is about adults too. So who are bringing the viruses to the young and the elderly in residential care homes, we think that we are healthy. But if we bring the virus to the young and the old in our family, it may lead to serious illnesses for them. Next question, the one in beige jacket, the third one. Hello, I'm from Ming Pao. I would like to ask something about transitional vaccine pass. There were members of the public who hold invalid medical exemption certificates. So will they be issued the transitional vaccine pass? How many people will be able to get this transitional vaccine pass? Also, I would like to ask about melioidosis. For the CHP, they have collected sample after adding residue chlorine. So what is the purpose of that? Are the samples collected too late? Currently, we do not know the path of infection. Is it because you have collected the sample too late? Also, the residue chlorine level has risen to 1.62, but there are still some melioidosis cases. So is it an effective measure in controlling melioidosis infections? That is a very good question. You are very familiar with the whole situation. The first thing that you mentioned that is very good is that many samples were collected after the residue chlorine was added. So that is important. That means that the residue chlorine is effective. Well, the incubation period is 21, but for some it can be longer than that. So we can't say that these cases were identified after the adding of residue chlorine. Do you have anything to add, Dr. Au? Well, since this is a statutorily notifiable disease, we can more effectively monitor the whole situation, especially in Sam Shui Po. We'll keep a close eye on that. According to the information that we have, by end of October, colleagues from the Water Supplies Department has increased the level of residue chlorine in the water. This will be extended to other districts. We hope to raise the residue chlorine level so that even if there are bacteria in the water, they can be killed. As for members of the public with invalid medical exemption certificate, whether or not they will be able to get the transitional vaccine pass and how many will that be? Well, for members of the public with invalid or expired medical exemption certificate, they will be able to get the transitional vaccine pass as long as they have plans to get vaccinated. For people with the first dose of vaccine, about 2,000 to 3,000 perhaps. So if they plan to continue with the vaccination in the future, then of course they can get the transitional vaccine pass. The last two questions. Gentleman from the left.
First, you mentioned that active checking of vaccine passes is needed for indoor and mask-off activities because of the high risk it posed. But some skating rinks and cinemas still require mask wearing at all times. So how do you justify these places still need active checking? And how can authorities ensure that there won't be any abuse of the transitional vaccine pass that you have mentioned? And on having PCR tests for arrivals, why is there still a need to do RAT daily for 7 days? Is there a possibility to cut the number of RAT needed? Thank you.
Okay, for the active tracking, you're right. Some premises, some cinema and some areas, indoor areas, they actually not allowed mask off, even they can actually. But this is exactly the question being asked last week by plenty of citizens. They cannot tell which premises, like which cinema they allow food or drinks and which they do not allow to do so. So it actually creates a very confusing picture to the citizens. And so that's why we changed the policy to all cinemas, you will need active checking. Basically, just the same as before. For the abuse, whether the exemption, the transitional exemption for the vaccination pass, basically how to avoid the abuse. If you actually look at a PowerPoint, basically we say that whenever you apply for a transitional exemption, you need to bring your expired or ineffective, you have to bring your vaccination exemption record previously with a 2D barcode to the center to certify that you really actually got an exemption certificate previously and it's no longer in use. And then you have to have started the vaccination program before we can grant you the exemption. Transition exemption right now. So I suspect with these two measures, basically it's very difficult to get abuse of applying this exemption certificate. For whether there's room for reducing the number of days using RIT, I would say this is too early to comment, too early to conclude right now. Maybe we actually cut the PCR for day 0 and day 2, and then we can look at the data again, see whether we can actually further streamline the RIT testing.
好，我哋問埋最後一個提問。sorry，右手。
Well, last question to the right, on the last row, the one in black, please. I'm from Hong Kong Economic Times. A question about the RCHEs, and we see an increase in the number of infection cases, but then there's just been a relaxation of the group arrangement and also the visitation arrangement. So would you review the risk and would you tighten the measures again? Another question on melioidosis. In Trengganu, Taiwan, North Point, we've seen cases too. Would you also do investigation there to find out the transmission route? And then, are there any patients of melioidosis who are also infected with COVID, and what is the increase in risk if someone contracts both diseases? And now, as for the transitional vaccine pass, some may have just had 1 or 2 doses, so what is the chance of them being successful in applying for the transitional vaccine pass? Dr. Au, on melioidosis, we will conduct epidemiological investigation for each and every case. We'll see if there are any epidemiological links between cases. We've done some environmental investigation. For example, there were 2 cases at the Eastern Pamela Yode Eastern Hospital, one in Taiwan, living in China, the other in North Point. But then we don't see any clusters. These are just sporadic cases. And then for new cases, we actually conducted genetic sequencing. We wanted to see whether the bacteria are the same as for the cluster in Shamshui-Po. And we find that for some of the cases, the genetic sequencing is not the same, so it's of a different origin than the cases in Shamshui-Po. So far, we believe that the outbreak is confined to the clusters in Shamshui-Po. While this disease melioidosis is actually an endemic disease, so we will see cases every year, especially between August and November. So we will see some cases in different districts. There's nothing unusual. What is important is that we don't see any clusters like in the case of Shamshui-Po. I wonder if Professor Yun has anything to add. Thank you for this scientifically based question. For the 2 patients in the Eastern District, their sequence type, one is ST72, one is ST77. For the Shamshui-Po patients, they are all ST1996. And also for the soil samples, it's also ST1996. So you can see, therefore, for the soil samples from the Shek Shui Kip Mei Service Reservoir and the Shamshui-Po patients, it's the same, it's ST1996. But then for the 2 patients in the Eastern District, there's no correlation whatsoever. Now, Dr. Ao works really hard. He would visit the homes of every infected patient. He would go and ask them whether they've been to Shamshui-Po and so on. But then with the epidemiological investigation, if there's just one case, it's not linked to another cases, and if we know that this is an endemic disease, then it's not worth making so much effort. But then in Shamshui-Po, we see some 20-30 cases in a cluster. Then of course there is need for a very in-depth investigation. And that's why I've collected over 500 environmental samples, and we did genetic sequencing to try to trace the origin of the cases. And this is an interesting question. Now, if you are infected with melioidosis and also COVID-19 at the same time, what would happen? Well, from literature, we could find very little information. So the answer to your question is we don't know. But then we have reasons to believe if you are infected with both diseases, then there would be very serious damage to your lung and serious inflammation, because COVID-19 would cause inflammation in the body. And of course, if you have not been vaccinated, then the condition would be worse. And then for melioidosis infection, also it will lead to serious inflammation. So we have reasons to believe if you're infected with both diseases, then your condition would be really poor. But then so far, there is not much information from literature. That's why we are not able to answer the question as to what might happen if you're infected with both diseases. But definitely we'll be monitoring that very closely, because we believe that these cases will stay. What is important is that everyone in the community is fully vaccinated. Now, especially when we have the new bivalent vaccine, you should take it. I will definitely take it. At the same time, you must also take the seasonal influenza vaccine. I did that too. I administered the vaccine myself with subcutaneous injection. And you can see I wear the mask all the time too. And I believe if I wear the mask all the time, then for seasonal flu and other upper respiratory infection, as well as COVID, or the RSV infection, well, there is little chance that we will be affected by all these three types of infections. So it's all a matter of, taking all these precautions. Now about RCHEs, the group arrangement. Now with this new wave of the Omicron variant is hitting us hard and fast, and so that's why we'll discuss with the Labour and Welfare Bureau on the arrangement. Now, you asked me how many people might benefit from the transitional vaccine pass. Now, there are currently about 19,000 medical exemption certificates that are still valid, and in the last month, for the number of lapsed medical exemption certificates, there are about 30,000. So that means these people would benefit from the transitional arrangement. Thank you for coming to the press briefing.